Good afternoon, everyone. My name is Lynette Roach, and I'm the External Relations Director of Black Health Matters. I'm here to introduce a very timely presentation about the impact of COVID-19 on Black children. The disproportionate impact of COVID-19 and associated disparities among Black children and other children and teenagers of color has been well documented. Today, you'll hear from two prominent pediatricians who will address this issue. First off, Marilyn McPherson Corder, MD, is a 1978 graduate of Howard University College of Medicine and completed her residency in pediatrics. Dr. Corder currently serves as clinical professor in the pediatric department at Howard University College of Medicine, the George Washington College of Medicine, University of Maryland Allied Health, and Duke University Medical School. She is the CEO and president of her private pediatric practice, Children's Medical Care Center of DC, since 1982, and also serves as chair of pediatrics at the United Medical Center. Dr. Corder has been an advocate for child and teen health for over 30 years and has been dedicated to serving the community both nationally and in the Caribbean, especially the underserved youth. Her most recent passion is the fight against childhood obesity. Now we'll turn to Dr. Frederick J. Corder. He is a 1977 graduate of Howard University College of Medicine. Dr. Corder completed his residency in pediatrics at Howard University Hospital and is the first board-certified Black pediatrician in Prince George's County. In 1987, Frederick Corder became chairman of the Department of Pediatrics at Prince George's County Emergency Medical Center. Dr. Corder established the Nightlight Pediatric Emergency Program at the Bowie Health Center in 1998. Dr. Corder has also served on the medical staff of Greater Southeast Medical Center since 1985 and was selected to be the first chief medical officer at the Prince George's County Health Department from October 2002 to November 2004. Dr. Corder's work in the community is extensive, from teaching to providing service in the community hospitals, but his latest project has been the development of the Quarter Pounders Fitness Program. This program is aimed at working with families and children to combat childhood obesity. Dr. Corder and his daughter, Adrienne Corder, are working to expand the program and change the tide of obesity and its consequences on the community. Drs. Corder, we are so looking forward to hearing from you today about how COVID-19 has affected the population of Black children.
Well, thank you very much. Thank you for the introduction. We had a lot of fun being here. We're glad to be a part of Black Health Matters. This is our second year being involved, and unfortunately, with COVID, we've had significant issues that have affected our community. And so we would like to just go over some of the issues that have come up with that. And when we talk about that, one of the big things that we always think about is, are we all right? That's always the question people ask, are we all right? Well, I always ask the question, what about the kids? What about the family? And big thing is it really over? And so we're going to take a few minutes, and Marilyn's going to particularly go over some points out, just some sideline comments of where we really are, how it has affected us. This has not just been a pandemic, it has had effects across the board and things that we have to look at. And so let me ask a few questions and let Marilyn go on that. Oh, I mean,
So, as we talk about, first of all, thank you and well, I'm honored to be here. And as Dr. Fred Corder said, things are still not right. We talk about a new normal, but we say it in a manner that it's okay. It's not okay. The kids are not all right. We have seen in the past 2 years with pandemic and a DMV, major developmental delays. So let's say a child at the time that the pandemic started was at 9 months of age, but then he's home or she's home with the parents and we wear masks, but no one's even coming throughout the house. So now they come out, they go to the doctor's office. Sometimes they're still at 9 months or 12 months, as opposed to 2 years developmentally. And that is significant. One other thing that we also see They've been in, so you have a school-age child. Now, let's think about what happens. It was virtual learning. Now, I know that many of the schools tried very hard to make sure that the students had the computers and had whatever they needed to learn, but they could not control the environment. That may not have been conducive, if it's a crowded household, conducive to studying. So if you have 4 children and everybody is trying to be at the kitchen table and everything else is going on at the kitchen table, it just wasn't working. And many of my parents, they were just wringing their hands in frustration of, oh my goodness, I can't wait till this virtual is over. I'm not a teacher's aide. I'm not a teacher. Everyone's frustrated. I don't think he learned anything. And then we reopened, we went hybrid, we reopened, and we saw gaps that we've never seen. We've been in practice now 40 years, and we've seen gaps that it's almost as if the child didn't know anything, and the regression. So we have problems with school performance gaps, disproportionate school performance gaps. Now remember, we were all stuck at home. And unfortunately, being stuck at home with people that you really are not used to being in your face all the time, we saw an increase in domestic violence. And with that, we saw an increase as well in child abuse. So everybody's upset. They couldn't get out, things were closed, people couldn't work. So we had financial hardships, we had social hardships, folks had attitudes. It was increase in drinking, increase in smoking, increase in domestic violence that led also to child abuse. And we see that and saw that disproportionately in our children and children of color in the household. We also saw high rates, and as chief of staff at one of the hospitals, as well as my husband is chief of pediatrics, saw a higher rate of children with COVID, as well as hospitalization and children of color. We think about it and we say, well, why is that? Sometimes it was because of the exposure from other folks in the household. Sometimes it was because by the time they were in the hospital presenting, they were much sicker than they otherwise would have been if they had access to health. So it's a combination of several things: social economics, as well as access, as well as even identifying when the child is sick and how long the child has been sick. So we saw that, and we're still seeing issues with that as well. I'm going to let Dr. Fred Porter go to the next topic, because again, we have so much to talk about.
One of the things we talk about are the developmental problems. And I've actually seen children having arrested of that development. Particularly these kids are toddler age groups who have sort of been there and haven't been able to sort of be out and be socialized. And so we have a big question at times of, do these children truly have developmental problems? Or is this an effect of the COVID, where we have kids who've been in since they were born, some at critical ages of 6 and 9 months went into seclusion, and their lack of other social exposure has significantly affected many children. So our developmental delays are real. Let's see those. Okay. Well, we talked about domestic violence. Thank you, Marilyn. Poverty has been a real issue. Even though we've had some of the extra monies that have been given out to people, we do know that it's not like real money. And unfortunately, households have not had money. And when you don't have money, it affects everyone. Many households relied on even school meals. They haven't been there. And so when we start seeing these kinds of poverty changes, that has increased our mental health complications. Not only that, we can't even get mental health. We've had children that we recognize, or families that we recognize, who are under stress. And because A, even the doctors and health professionals haven't been in their offices, but B, they're trying to do everything virtual. And sometimes it just doesn't work trying to do virtual. And so that has added to our mental health crises that are happening.
And with the mental health, we have to recognize it for what it is, and we have to make sure that all of us that's around that child, from the physicians to the grandparents to the school, address it as much and soon as they can, because it can as we know, lead to more drastic and severe suicide and major depression, etc. You want to take that one?
Yeah, we said decrease the healthcare. People haven't been going. I mean, for a while, everybody had to close their offices. And so even routine checkups weren't being done. Acute illnesses weren't being addressed. People sometimes just waited. And as the COVID pandemic got worse, people were more afraid to go out, which meant that there wasn't healthcare happening. And so we were seeing not just lapses in immunizations, but sometimes even lack of adequate care because of not just availability for transportation, but the fear of even going out. And so there's decreased access to healthcare, both on the healthcare system. You know, they would even call you up and says, if you have COVID, don't come in. Well, suppose you don't have COVID, but you think you have COVID. You literally couldn't go in. Okay. We talked about the disparities.
Well, you know, going back to the decreased access, so many people practices in the poverty-stricken communities suffered the most. Many of the frontline doctors, they didn't come in work, they got sick, they were stressed to the point where they could not see the patients. So often it was overwhelmingness of going to the emergency room, which we know what happens in terms of exposure to the emergency room. So many of the patients just didn't go. And as I mentioned earlier, they got sicker. So we saw them, and by the time we saw them, they were suffering things with acute respiratory problems and the different illnesses that they had, from diabetic to asthma, was really, I call it collateral damage, was much more in a state of unstableness and acuteness. So that definitely we still see it, and we're still suffering from it, and the community is still suffering from it. And so we have the increase in health disparities, that the gap is even increasing more and more, unfortunately. So, and we could see it across the board here in the district of the different wards, the wards that are socially, economically less fortunate than other wards. So it's even showed in life, the lifespan. It dropped in Ward 7 and 8, like 2 years, and we haven't seen that. I mean, you know, the gap was going a little better, and we were living older, longer, living to older age. Now we took you know, it's almost as if it was, well, it is a pandemic, but it majorly shook the core of interest of families of color. And one thing I do want to say, we saw quite a few children who are orphans now. Their parents both died. I can't stop thinking about a call that I received from one of the leaders in the community saying we have several hotels that we now have children wards for housing because both of the parents are sick. And one particular family, mother and father were both on vents. They waited too late. They came in acute respiratory distress, both on vents, and they were in comas. They had a 7-year-old, 11-year-old, and a 9-month-old. So the 7 and 11-year-old were able to be housed in these particular, you know, hotel for children, et cetera, that had social workers, et cetera. But the 9-month-old, they didn't have any place for that child. So I remember calling around, helping them call around, and found a grandma, not related to them, but we called her grandma, and she said, yes, I'll take that 9-month-old. They were all positive for COVID, let me mention that. So we had the entire family positive for COVID, and this angel in the community took that child. Needless to say, those children are orphans. So we now see that. So we're talking about disruption of houses and now homes and now parentless. So that we see more and more in our community. So we're talking about a major effect of children of color.
Yeah, when we talk about disparities, we all know that health disparities already has asthma, diabetes, obesity higher in our community. And if you were listening to what were the things that were causing people to have bad outcomes with COVID, asthma, history of respiratory problems, obesity, All these things that we already had a health disparity now became a added burden on the Black community. And it has that burden. I even have children who are afraid to go outside because they've seen their grandparents die, they've seen mothers and fathers' friends die, mothers and fathers, so they just don't want to leave. And even as we're now trying to get kids back into school, some of them still can't get their emotions together to do that. And so our healthcare disparities have gotten worse. It has actually compounded the whole COVID complication over the last 2 years. We talk about obesity. Well, before the onset of the pandemic, we said that about 1/3 of the American population was within normal weight range. We said that another third were about what we call overweight, which is about 10 to 15% above what is accepted weight. And then another third were over that 15%. Well, guess what? We're now at about 1/3 at normal weight, about 5% at that slight obesity, and the rest are now obese, which means that we have increased another health disparities. And the big thing with that is that children became like adults. Why are adults overweight? Well, ask an adult last time they walked someplace. Ask them how many exercises they do. Well, that's what happened to children. We actually sent our children home. We told them to stay in the house. They couldn't go outside. And so here they were eating and eating more and more and putting on weight. So our obesity has been significant in our young adults, particularly starting around about 5 to 6 years of age, into our early teens and into adulthood. So obesity, already a premorbid or a predisposing risk for COVID, now has increased in our population, even among our young adults. And because of this, I've even seen young adults with diabetes, which usually you don't think of diabetes in those 13 to 20-year-olds, but we actually are seeing that. And not type 1 or the new onset or what we call type 1 diabetes. This is type 2 that comes because of your weight gain. Okay. Well, vaccine hesitance. What would you say about that?
So I'm gonna go back to the obesity. So unfortunately, we're seeing it younger and younger. And because of, again, the food shortage and the lack of good foods and just the quality of foods. And as you said, even when the schools were closed, sometimes whatever they had at the home, they ate. We continue to eat. So hypertension, you need to mention that as well. And even polycystic ovaries. I mean, I'm thinking about things that, again, we see in older people, we now see in children. So the children who's 18 years old, or even 15 years old, are looking like 30-year-olds. And that's certainly something that we have to address. And then they're with them not having success or seeing where things are just in disarray and not in a happy time. We have children who are, again, just hopelessness. And we talked earlier on the show with Dr. Lawson, and we just talked about this, just that sometimes they're just giving up. So we see this and we need to break through. We're in the pandemic, but we need to recognize. And if ever there's a time to have community rec centers and outreach, et cetera, this is the time. This is truly the time. Vaccine hesitancy. So that's our next topic. That's our last topic, but that's a big topic. And I say that because we see more vaccine hesitancy in our community. I get it. I understand. We know our history. We know what happened. And there's a concern about government, vaccination, experimentation, what's it going to do? But we have to educate those out there to let them know this vaccine is not going to interfere with your DNA. This vaccine is an mRNA. This vaccine has gone through the evaluation, et cetera. Now, we did have some that initially had the emergency utilization authorization for those who are frontliners like we are, for those who have multiple illnesses and are high risk. But let me say with children now, the 11 to 18-year-old, the vaccine Pfizer that makes the other vaccines that your children have had for years has been CDC approved, American Academy of Pediatrics approved. So it's no longer just the EUA, the emergency utilization. They're coming up with another vaccine. They're taking their time, thank goodness, and that's the vaccine for 5 and lower. We have the 5 and above, the 5 to 11-year-old. And I know that when we look at the rates of populations that's least vaccinated, we still see a lag in children of color and families of color, therefore children of color. So in addressing that, we need to let them know that the person who did research and this vaccine has come out was a Black woman, Dr. Corbett, Kizzy Corbett. And so, you know, and did she get the vaccine? Yes. It wasn't just us. More people are getting the vaccine that are not color. So, and yes, all vaccines have side effects. I get that. I know that. But compared, we're talking 0.001 types of side effects compared to getting COVID. And COVID has side effects. We're now seeing COVID, the long haul COVID effects in children like we're seeing in adults, from cardiovascular to lungs to even brain fog and affecting. And we don't even know what's going on with this new finding of hepatitis. So, you know, the answer is not always so clear, but we do know that the studies show those who have been vaccinated have less chance of being hospitalized. And when we had the second wave of COVID, the variant, it was the hospitalization for those unvaccinated. And that was what the pandemic was about. The ones that were in the hospital, 80% up to, in some areas, 95% were those individuals that were not vaccinated. So that's why we need to educate and make sure, understandably, respect the vaccine hesitancy, but all the while making sure that we educate one family, one patient at a time.
Well, those are our big points. And that, you know, it's not just that this was a pandemic and we all went home, but that it's affected our lives in many different ways. It has affected education, it's affected development, financial, and we're still seeing long-term effects from that. We're still seeing children afraid to go to school. We're still seeing, and our educators will tell us that when you look at how kids are doing in school, they are not doing well in school. And some of them, as they're come to school, we're saying, well, are they able to learn? Well, we've got 2 years for them to catch up now. And so we have to readjust how we're handling this. How do we handle the stress? How do we handle the disparities? But most importantly, we have to work together as a community to make certain that, one, we can help bring this to an end, and two, we can restore or begin to build better health in our communities.
So we still have a few more minutes left. And I think that what I feel as a parent, as a provider for my practice, as a grandparent, we need to take a step back. First of all, be grateful that we are still alive, but take a step back and understand what happened, how it affects not only yourselves, because I know the front line, we had lots of folks who were sad, depressed, and even suicidal, but also how it affects that young mind. What if you, as a child, had this happen? You know, we have coloring books now. We talk about it. What is COVID? They wear their mask. These children wear their mask better than we wear our masks. But they're afraid. And it's like they go out, and as we said, we saw the developmental delays, the arrest of the developmental progression. But we also see disturbances in sleep. We also see heightened anxiety and jitterness and just afraid for the next phone call that the parent or somebody is sick. You know, we teach death and dying and acceptance of that, but the volume, this child, classmates, mother or father is sick, etc. So we have to really, as a community, understand that general medicine, yes, that's fine, but we need to pair that with behavior health, with mental health stability, and ask those questions. And ask those questions of your young person as young as 3 or 4 years old. How you feeling today? What upset you? You know, what you thinking about? Because often they can be overwhelmed with what's going on with the pandemic, cut the news down, make sure they're in a positive environment, and, and talk and get that communication. And when you see signs of sadness and depression, seek help, call your primary care, call this teacher, call your neighbors, but we all here can help. And I call it help the village. And that's important because no child should be alone in the sadness and the grief through this pandemic. Again, we're still in the pandemic. We had calls just today, and these are younger children. So we don't know all the while, all the long haul, but we do know we need to still be on guard and be mindful of what we're still going through for the sake of the millions of people who have died. So again, I want to thank Black Health Matters for this wonderful conference. We had a ball, we educated, we found out a lot of information, and this is our first in the 2 years of having it in person. So Black Health Matters, you rocked it. Thank you so very much.
All right, maybe we can entertain any questions that the audience may have. We can hopefully help with that. Do we have any questions?
Thank you. Oh, I love the Purple Heart, Joni.
Okay, I don't see any questions at this time. So I do want to thank everyone. I appreciate the time to be here. We've enjoyed being involved. Oh, here's one. How can we support teens to stay away from violence? Well, good thing is we have Dr. Marilyn Porter, who is actually an adolescent medicine specialist. That's what one of her trainings were about. So Dr. Marilyn, how can we help?
Okay. So one of the things you want to do is make sure that they have a positive outlet. There are times sometimes that's all they know, and it's exciting. There's a person who's, flashing this and flashing that, a car, etc., that may be stolen. But you want to have them involved in positive groups, be it soccer, martial arts. Lots of programs are men-to-men programs, etc. Role models. We have lots of families that are single moms, and their sons may need to have some type of mentoring, etc. Lots of those are still around, but you want to also understand who they are pairing up with and who their friends are and what their friends are doing. This is the time to also be a little nosy. I'm sorry, I know they need privacy, but in terms of what's in their room, what's on their laptop, what they're talking about.
Okay, thank you. We also had a question about what can we do to get information about COVID. Our library, believe it or not, our library. They now have lots of new literature that's coming out. You can find it in your local libraries. Sometimes you may go online and find age appropriate, and that's what's important, age appropriate. We don't need to talk about the millions of people who've died to a 6-year-older, but we do have to talk about that grandma passed, okay, to a 6-year-older, and then what's happening there. So I think that if we do go online, start making certain that it is age appropriate. And that's been one of the problems. Because we've sort of been blasting this news, it looks like the children aren't paying attention, but they are. They are hearing the tickers that come on every day of how many people have died. They've heard about how you can't go outside, how it's dangerous. And that has added fear and anxiety. So age appropriate counseling, talking to children when they're ready. We as adults want to schedule an appointment and do something, but not always for children. Sometimes you can be riding down the road and all of a sudden they'll start talking about, what's been happening in the news. Why is this going on? Or they may start changing their behavior and they're thinking about other things. And so age appropriate intervention and continued counseling.
There's an author, and I'm gonna grab my phone real quick. Can you have the phone? That it's a Black author, as a matter of fact, and she has coloring books, and it talks about COVID, how we can fight COVID, and I know we're about to run out of time, but I'm gonna see if I can pull the information up, and if not, I will post it, if I can't find it in a short period of time that's left. I would post it because these books are really, I feel they address the anxiety and the information. So see if there's another question while I try to pull this up.
Okay. All right. Our final, any more questions? I think we've covered pretty much everything. I'm not trying to think of Marilyn. All righty. We may,
Okay,
here we
so
are.
the name of it is Mean COVID-19. MEAN COVID-19. And I don't know if you can even see. Okay. Okay, and when you pull that up, you'll see that's the author, all right? And she's a teacher, but it's Mean COVID-19. And it's another one, COVID-19 meets the vaccine. Her name is Carolyn Hunter, Carolyn, Carolyn Hunter. Mean COVID-19 is the first book. She wrote another one, COVID-19 meets the vaccine. So please write that, and that's important that, yeah, there we go, Carolyn Hunter, all right? See, we can find that information out on the doc, and I know her personally, and I've read her book, and it really helps as you go through. It really helps that young person understand in their own way, and that's the literature I recommend.
Okay. Well, I want to thank you all very much. It's been our pleasure being a part of Black Health Matters, and we look forward to continued involvement. Thank you, and everyone stay safe. Take care of your loved ones. Look out for their both physical and emotional well-being.
Because our total Black health does matter. Bye-bye.
Thank you.